Well, one thing that we talk about with every patient when they come in is risk. And if you're watching this, you're looking for facelift risks because that's an area of interest to you. And so we can break that down into very specific risks and general risks, and we'll get to each of those. I think the first concern people have is actually how they're going to look. They consider that they may not look the way they want to or what they want the outcome to be a risk. And that's definitely a possibility because we always have this image in our minds that's the extreme goal that we really want. And most of us realize that that's a goal that we can get close to but not, ever meet exactly, and we can be happy with that. And we kind of have to make sure that that expectation is set, that you're going to get an improvement, but it is a risk that you're not going to get exactly the exact face that you were hoping for. So that's a good place to start. But then there's the actual surgical or medical risks that we go through. The first of those is bleeding. If bleeding is going to be a concern, it is going to be the first night of surgery. It's very rare for any issue after that. That is called a hematoma. So a hematoma is where blood collects underneath the skin. That can cause a swelling either in the cheek or the neck area, wherever that accumulates. If that happens, it needs to be addressed at that time. That's why at our center we have people on call all the time. We can call in anesthesia, we can call in the nurses, and we can take care of that. So hematoma, a first day risk. And then we get to the risks that show up more about a week out as a complication, which would be infection. Infection is very unlikely in facial surgery. Main reason for that is because there's an extremely good blood supply to the face. Part of the problem with having a hematoma is because there's such a good blood supply. But that good blood supply allows the infection-fighting cells to get to the area. So it's really unusual to see infection, but it's a possibility. And if it happens, it's going to be about a week out. The other thing that might start to show up about that time is if all the tissue that has been tightened is not healthy. That in its medical term is called necrosis, where some of it actually dies. So a little bit of skin may die. And in rare instances, and thankfully nothing that I've ever seen, but you could have substantial amounts of skin that have an issue, and that could lead to widened scars or other things that are necessary to fix it. So that is a risk. A complication or risk of the surgery that might show up even a little bit later than that is if all the nerves that move the muscles of the face do not come back completely. Again, very unlikely with the style of facelift that the surgeons here perform, but still a possibility. You're going to have a scar after a facelift surgery. Now, we want that scar to be really nice. There's a risk that it's a bad scar, but it's a reality that there's going to be one there. Most of those scars are difficult to see when you get even up close, but you've got a magnifying mirror and you kind of get a good look at it in good light. Yes, you're going to be able to see that incision and that scar. We do our surgeries at the office, and there is a question that comes up with patients: is it safe? We feel it's extremely safe. We know that nothing is perfectly safe. I have a nice safe car, but I know that it is not without risk to be in that vehicle. At the facility, we do everything we can to make it as safe as possible. Just like driving with your seatbelt and having your vehicle serviced, we make sure that we are certified, that our machines are checked yearly, that someone comes independent from the practice to look at it, to look at our processes, to look at our people, and make sure that we're meeting all the type of criteria that are necessary, and we do that consistently. Our staff is certified in advanced cardiac life support, and we redo that every 2 years right on schedule to make sure nobody drops any type of certification. We have full anesthesia services where there's somebody who's dedicated to just that patient doing their anesthesia. So you have your anesthetist there the entire case to take care of you. We even have some redundancy. Today, doing surgeries, I had extra anesthesia available. Not that it was necessary, but we had plenty of help, and we don't want to be staffed to an area that we have concern for that. So we overstaff. We have extra nurses available to help out with the cases if necessary. We have the other doctors around, and that's a huge thing for us, is that operating here, with another doctor, not just one, but 2 others. So we have 4 of us in the building. If there's a question, if there's a concern, you can call them in and kind of get a second opinion or a third opinion or a little bit of backup on what you're doing and saying exactly that's right. Or, you know what, maybe we should consider this. That makes us safer. So what do we need from the patient to prepare for surgery? We need honesty, both in what their expectations are and in what any medical conditions they have might be. We need to know if you have diabetes. We need to know if you have high blood pressure. We need to know if there might be sickle cell disease or trait in the family. These are all things that we can handle, and we can make ourselves safer by preparing for them in the case. Medications that you're taking, we need to know, because there's some that need to be stopped in order for us to make it safer, or we might say, you know what, we really shouldn't do this. It's not an appropriate thing. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.